Medical records can be hard to keep track of, difficult to read and to keep up to date. This can lead to errors and unnecessary readmissions, costing the NHS time and money. So the East Lancashire Hospital's NHS Trust has created an electronic bundle of information that follows a patient from admission to their GP surgery. It makes sure that every step of the patient's journey is monitored and recorded in a way that ensures a smooth transfer of care. Our reporter Estelle Matthews went to Blackburn and met the pharmacy team behind these changes.
From the moment a patient arrives in hospital, they should expect integrated care. But keeping patients' pharmaceutical information tracked and up to date can be challenging. So getting the process right at this initial stage is vital to the transfer of care for patients for the rest of their stay and beyond.
I'm from the pharmacy. I just want to check to see if you've got any medication with you. Is that okay?
The pharmacy department at East Lancashire Hospital's NHS Trust is striving to improve medicines reconciliation on admission and provide a seamless service. They've come up with innovative ways to use new technologies and introduced efficient systems to reduce medication errors and improve transfer of care throughout the entire patient journey.
I'm just trying to find out what medication they're on when they've come into hospital so that we can change it or see whether it's got anything to do with the problem that they're in hospital. And then I'll document it all down on paper and then I'll put it onto the electronic tracking system and pass forward any notes that need to be passed on to anybody.
Hi Lauren, would you be able to order some Laxedo for Mrs Smith from the robot?
Yeah, sure.
It's important that the patient and the pharmacist communicate throughout the patient journey. To manage this process, the pharmacy department at ELHT has been active in embracing new technologies. As well as e-prescribing, they've implemented a medicines reconciliation module to the Trust's electronic patient tracking system. They've been an integrated care organisation since April 2011 and are also early adopters of the Royal Pharmaceutical Society's transfer of care guidance. Medical staff and patients are already seeing better quality outcomes from this initiative.
It helps us to enable the correct list of medications to be available at the time of the ward round. It helps us to make sure that the right blood results are available to make the correct decisions, which obviously benefits patient care and makes things much safer for the patient and for the hospital team.
The pharmacy team at ELHT have made enhancements to their electronic discharge letter that makes transfer of care easy and accurate.
On our letter here we've got a section which demonstrates which medicines have been started, stopped, changed and why. And further down we have a section which allows us to make referral to community pharmacists for new medicine service review. What we've done here that's innovative is to change the way our prescription chart is designed so it's transfer of care friendly. We've also changed our electronic discharge letter to make it a lot easier for prescribers and pharmacists to make sure the right information goes back with the patient to the GP and also to the community pharmacist.
Making sure medicines information is transferred accurately as patients move care settings is a goal for all healthcare professionals.
The hospital have changed your medications and started some new things.
The new processes that are now in place at ELHT ensure that the right information about medicines and ongoing patient management plans goes back with the patient to the GP and community pharmacist, making a significant difference to the patient experience.
We're now in a situation where we've got much more detailed information and that's helping to improve patient care, but we're very aware of the fact that this is a journey and there are further developments that we want to make so that we're able to transfer information into the hospital when the patient's admitted and also that the information will be transferred back to the GP practice when the patient's discharged so that there's a continuous flow of information and that allows much better quality patient care.
The ELHT pharmacy department is completely patient-centred and provides services to its users throughout the patient journey, from admittance through to discharge, through to being at home. A real pharmacy without walls.